So now let's talk about the types of fluids. So first we're going to start with isotonic. So isotonic fluids, the little key phrase to remember is it stays where you put it. So these fluids stay in the blood vessels, and that is in your intravascular space, and they help expand blood volume. You will use this when a person needs more circulating volume, but not a fluid shift in cells. So example, this is going to be your 0.9 normal saline, this is going to be your lactated ringers, and this is going to be D5W. So D5W acts as an isotonic in the bag, but it becomes hypotonic in the body. So why would we use isotonic fluids? We would use them for if a patient is experiencing hypovolemia, which is low volume, right? Low blood volume. So if a patient from dehydration, a hemorrhage, or shock. So remember, hypovolemia, we're going to go with isotonic fluids because we want to increase that circulating volume, right? If your patient has a burn, you want to restore loss of fluids and electrolytes, and LR is preferred. But you'll see some facilities go-to fluids is normal saline, and some facilities go straight to LR. So they're both isotonic. Surgery/trauma, and that could be to maintain blood pressure and volume. So remember, isotonic, it stays where you put it. So it stays in the blood vessels, and it helps expand your blood volume, okay? The next one we're going to talk about is hypotonic solutions. So the little key phrase for this one is go out of the vessels. So hypotonic fluids, these fluids move into the cells, causing them to swell. So think of that. Hypo, I think of hippo, you're big, okay? So you want to remember that they cause the cells to swell. So it's used when cells are dehydrated and need water to move inside. So think about it, hypotonic water then is going to come, the cell is dehydrated, but now we need to hydrate the cells. So we're going to use a hypotonic solution, and that causes the cells to swell. All right, so examples of that is going to be 0.45 normal saline, so half normal saline, and then you can have 0.33 normal saline, and then you can have D5W. So you remember, I said that D5W, that is an isotonic when it's in the bag, but once it hits the body, it's going to be hypotonic. All right, so please don't get that confused. So what is going to be used for? So you can use hypotonic solution if a patient has DKA, and DKA, you will learn about that in the weeks to come. But if you are not in my class and you're watching this, you could just go on over to my playlist of the endocrine, and you'll see the whole diabetes lecture. But cells are dehydrated from high blood sugar. All right, then we can have hyponatremia, which means that we have a bunch of salt, right? High sodium levels. So this helps dilute the sodium levels. And then when you have cellular dehydration, we then can use hypotonic solution, and causes the fluid to go inside the cells. So important thing that you want to know is do not give to patients with increased intracranial pressure or burns or shock, because this can lead to worsening when the fluid starts to shift and things like that. So that is so important. So remember, with hypotonic solution, the fluid is going to out the blood vessels, and the fluids is going inside the cell, and it's going to cause the cell to swell. Cell to swell. That is going to be hypotonic. So the last one is hypertonic. So hypertonic fluids, they enter the vessel. So these fluids pull water from the cells into the bloodstream, making the cells shrink. Again, so hypertonic says that, guess what? These fluids pull water from the cells, so the water is going to be in the cell. It's then going to leave out the cell and try to go into your little circulatory, your bloodstream, right? But it's now going to cause your cell to shrink. So that's important to know. So examples of that is going to be your 3% sodium chloride. You can also have hypertonic solutions such as D5 normal saline, and then we can have D5LR, and then we could have D10 W. So this is going to be used for patients who have severe hyponatremia, because it pulls sodium into the bloodstream. Okay, so if a patient has low sodium levels, they can use a hypertonic solution. If your patient has cerebral edema, which is brain swelling, that reduces brain swelling by pulling fluid out of the brain cells, right? But you just want to make sure that you do that so carefully. Normally, hypertonic solutions are done in the ICU. All right, fluid volume overload with a low sodium. So let's say the patient had SIADH, because that corrects the water imbalance. So you want to make sure that you are monitoring this patient carefully. Like I said, this is normally done in the ICU because it can cause fluid volume overload and high blood pressure. So you have learned a lot. So now let's do some NCLEX questions. The NCLEX question says that a nurse is caring for a client receiving IV fluids for severe dehydration. Which assessment finding requires the nurse to slow the IV infusion? Is it A, a dry mucous membranes and tachycardia, B, crackles in the lungs and shortness of breath, C, low urine output and dark concentrated urine, or D, orthostatic hypotension and poor skin turgor? If you chose B, then you are correct. So if a patient is receiving IV fluids for dehydration, and now you can hear crackles in their lungs and they're experiencing shortness of breath, well, maybe those fluids are running too fast, and now we're pushing that patient into fluid volume overload. A client is receiving IV fluids for dehydration, begins exhibiting dyspnea, crackles, and a bounding pulse. What should the nurse do first? A, stop the fluids. B, lower the head of the bed. C, administer oxygen. Or D, notify the healthcare provider. So what are you going to do first? If you chose C, then you are correct. So you guys, one thing about these questions with priority. So first you will need to administer the oxygen because the patient is exhibiting shortness of breath. So while you throw that oxygen on, after you throw that oxygen on, you then can stop the fluids, because we know that this patient is probably in fluid volume overload. But let's say that we stop the fluids first. No, we need to help the patient's shortness of breath first, then stop the fluids. A client with heart failure is receiving IV fluids. The nurse should question which order. Is it A, 0.9 normal saline at 75 mL per hour, B, 3% sodium chloride at 100, C, dextrose 5% in water at 50 mL, or 0.45 normal saline at 50 mL? If you chose B, then you are correct. So 3% sodium chloride is a hypertonic solution that draws water out of the cell into your extracellular space, increasing your intravascular volume. So administering this solution at 100 can lead to significant fluid volume shifts and volume expansion, posing a high risk for worsening heart failure and could even cause pulmonary edema. Therefore, this order should be questioned. So we want to make sure that we remember that this patient, we want to look at the clues in the question, and the question tells us that this patient has heart failure. So let's go through each answer option. Let's say, why could we use this one? So could we worry about the order for normal saline is an isotonic solution that expands your extracellular cellular volume. While it can be used cautionally in heart failure patients, the rate and the volume must be carefully monitored. So it's saying like, okay, we should be careful with normal saline, but the rate of it isn't that fast. All right, and then also, let's see, the D5W. So D5W initially is isotonic, but remember, once it hits the body, it is hypotonic. So that leads to free water from being added to the body. So at the rate of 50, it provides minimum fluid and is less likely to cause fluid overload. However, continuous monitoring is still essential. And then the half normal saline, it says that normal saline is a hypotonic solution that causes shifts in the cells, and being that it was only going at 50 mLs per hour, that is generally safe, but even though you should carefully monitor them. So the rule of thumb is that anytime a patient with heart failure is receiving IV fluids, you want to make sure they are being monitored. But we know that that patient cannot be receiving that hypertonic solution, because that hypertonic solution is going to draw water out the cell into the intravascular area. So I hope you guys got this one correct. I know I was kind of lengthy with the response a little bit. The question says, a nurse is preparing to give IV fluids to a client with burns. Which fluid is best? Is it A, D5W, B, 0.45 normal saline, C, lactated ringers, or D, 3% sodium chloride? So if you chose C, LR, then you are correct. So remember, lactated ringers, that is a isotonic solution. So remember, isotonic solutions, they stay wherever you place them, which is in your intravascular area. So that will restore their intravascular volume and correct any type of imbalances that you have. This is evaluating a client receiving diuretics for fluid volume overload. Which finding indicates treatment is effective? Is it A, increased blood pressure, B, a weight loss of 2 kgs in 24 hours, C, decreased urine output, D, increased jugular vein distension? So I'm going to give you some time to think about it. But if you chose B, a weight loss of 2 kgs in 24 hours, then you are correct. So we want to remember that weight is the best indicator for fluid measuring fluid balance. And that's a wrap, you guys. I hope that this video was helpful in helping you learn fluid imbalances and the different types of fluids. So go ahead and like, comment, subscribe, and share it with all your friends. So I will see you guys in the next lesson.